Hi guys, my name is Annalise Kotios and I'm going to be talking about the Bordetella pertussis virus. So first I'm going to discuss the background of Bordetella pertussis and the etiologic agent. So Bordetella pertussis is a gram-negative bacterium that is the causative agent of pertussis. Pertussis is also a term for the whooping cough infection. The disease pertussis was described by French physician Guillaume de Bayeux after the pertussis epidemic in 1578. The causative agent was identified and isolated in 1906 by Bordet. Pertussis is a highly contagious respiratory disease caused by the bacterium Bordetella pertussis. Pertussis, or the whooping cough, is known for violent coughing fits, which makes it hard for people to breathe. After the cough fits, people tend to need to take large breaks, which result in a whooping sound. Bordetella pertussis belongs to the domain bacteria, genus Bordetella, in the family Alkylogeniaceae. So adolescents and adults are an important reservoir for Bordetella pertussis and are often the source of infection for infants. Infants are the most vulnerable to this disease. Bordetella pertussis is a strict human pathogen with no known animal or environmental source to exist. The people at most risk for pertussis are pregnant women, babies, people in close contact to a known case, an individual with a weak immune system, and the elderly. So next, I'm going to talk about the morphology of Bordetella pertussis. So the picture on the left shows the virus under a microscope. It is a gram-negative bacterium. The picture on the right displays a diagram of the bacterium. It is small and rod-shaped, and it is coccoid. It is encapsulated and does not produce any spores. It is also a strict aerobe. Next, I will be discussing the virulence of Bordetella pertussis and the mechanism of infection. The Bordetella pertussis bacteria attach to cilia that line the upper respiratory system. Virulence factors include adherence to adhesions, filamentous hemagglutinin, fimbriae, and pertactin that allow Bordetella pertussis to bind to cilia that line the upper respiratory tract. Once attached, toxins produced by bacterium allow colonization to happen due to interference with host clearance mechanisms. This causes inflammation of the respiratory tract, which therefore interferes with an individual being able to clear pulmonary secretions from their lungs. Pertussis is a highly contagious respiratory disease that is transmitted human to human via respiratory droplets. I will discuss this more in later slides, but the incubation period is about 7 to 10 days on average. The picture at the bottom shows the mechanism of infection, if you would like to see a visual. So the signs and symptoms of pertussis develop within 5 to 10 days prior to exposure, but sometimes do not develop for about 3 weeks. Some early symptoms include a typical cold-like symptoms, a mild cough or fever, apnea, or a runny nose. Later symptoms include paroxysms, vomiting, and exhaustion after coughing fits. There are 3 stages of pertussis. The next slide. The cauteral stage, the paroxysmal stage, and the convalescent stage. So the cauteral stage may last about 1 to 2 weeks and include symptoms such as runny nose, low-grade fever, and a mild cough. During this time, you are the most contagious to those around you. The second stage is known as the paroxysmal stage. This lasts for about 1 to 6 weeks, but may extend to 10 weeks. Symptoms include fits of numerous rapid coughs following by a whooping sound. There are also symptoms such as vomiting and exhaustion after coughing fits. Lastly, stage 3 is a convalescent stage. This lasts about 2 to 3 weeks, and here you are susceptible to other respiratory infections. This includes a gradual recovery and lessening of cough fits, but it is still likely to happen. Pertussis is transmitted from person to person via respiratory droplets. Individuals with pertussis usually spread the disease to another individual by coughing or sneezing. The incubation period, as stated before, is about 7 to 10 days on average. Prevention against pertussis is mainly to get vaccinated and stay away from infected people. There are 2 vaccines that are available to help prevent the whooping cough, and this is the DTaP and Tdap vaccine. So the DTaP vaccine is usually given to children under the age of 7 in order to develop immunity to the whooping cough, and can also help develop immunity to diphtheria and tetanus. Tdap is a booster immunization given at age 11 for continued immunization from the whooping cough, diphtheria, and tetanus for adolescents and adults. And in the picture on the bottom right, you can see the differences between the two. So there are several types of lab tests to diagnose Bordetella pertussis or pertussis. Isolating a culture is typically known as the gold standard method because it is a 100% specific method. Lab techs obtain isolates from cultures that allow for strain identification and antimicrobial resistance testing. It is best to obtain the culture from NP specimens collected during the first 2 weeks when an individual develops a cough. Other tests include PCR and serology. PCR is a rapid test with excellent sensitivity. They test PCR from NP specimens taking 0 to 3 weeks following the coughing onset. The high sensitivity of PCR tests can increase the risk for false positives. Additionally, serology is used to confirm diagnoses. For the CDC single point serology test, optimal testing for collection of a specimen is about 2 to 8 weeks. So pertussis is treated by a doctor prescribing antibiotics to kill bacteria. There are 3 antibiotics that are typically used to treat pertussis. This is azithromycin, clarithromycin, and erythromycin. These are all macrolide antibiotics and are used to stop the growth of bacteria. If an individual had pertussis for 3 or more weeks, a doctor will not prescribe antibiotics because the bacteria is technically already gone. Finally, the best way to prevent pertussis is to get vaccinated with DTaP or Tdap vaccine. If a doctor confirms you have pertussis, your body will have a natural defense immunity to future pertussis infections. Some observations suggest that prior to having pertussis, an individual will gain immunity for about 4 to 20 years. Since protection is not lifelong, it is highly recommended for people to get vaccinated. Antibiotics are used for people diagnosed with pertussis, but a doctor may also recommend preventative antibiotics for people exposed to an individual with pertussis. The most important thing is to always practice good hygiene in order to prevent contracting the virus. So that is the end of my presentation. And then here, there's a few review questions that you guys can answer if you would like from my presentation. So first one is, if a person is diagnosed with pertussis, what will a physician give them for treatment? And then the second one is, name the 3 stages of pertussis.